medical terminology. Right. National EMS Education Standard Competencies for this chapter. Medical terminology uses foundational, anatomical, and medical terms and abbreviations in written and oral communications with colleagues and other healthcare professionals. EMT, introduction. EMTs need a working knowledge of medical terminology. With this knowledge, the EMTs will be able to understand key terms, symbols, and abbreviations. We use medical terminology to determine the meaning of an unknown word by understanding how the terms are formed and learning the definitions for parts of a term. We also use with knowledge of medical terminology, we'll be able to understand medical jargon, and this leads to effective communication with our peers or persons in the medical profession. Anatomy of a medical term. So medical terms are made of distinct parts that perform specific functions. Changing or deleting any part can change the function or meaning of a word. Components that comprise medical terms include word root, prefix, which is usually at the beginning, suffix, which is at the end, and combining vowels, which help with the pronunciation of a word, and combine two word roots or root. How the parts of a term are combined determine its meaning. Accurate spelling is essential. Phasia means speaking, phasia means eating or swallowing. So phasia with S-I-A and phasia with G-I-A are two different meanings. The S-I-A is speaking, G-I-A means eating or swallowing. If we add the prefix this, it means difficult or painful. So if we add that at the beginning of dysphagia with SIA, that's difficulty speaking. If we add that to the beginning of dysphagia with GIA, that is difficulty eating or swallowing. How the parts of a term are combined determine its meaning. Also important is the knowledge. Also important with these the parts of the term, it will enhance your knowledge of anatomy, and you'll get an understanding of the context of how words are used. Word roots. These are the main part of the main part or stem of a word. It conveys essential meaning and frequently indicates a body part. If we add or change a prefix, remember your prefix is at the beginning, suffix is at the end. If we add a prefix or suffix to a word root, it can change the meaning of the term. Cardiopulmonary breaks down into cardio, which is a word root meaning heart, and pulmon is a word root meaning lungs. Now, prefixes, which are found at the beginning, they appear at the beginning of a word. They usually describe location or intensity, and it gives the word root its specific meaning. Suffixes appear at the end of words, usually indicate a procedure, condition, disease, or part of speech. Combining vowels connect word roots to suffix or other word root. Most cases it's an O. It may also be an I or E, and used when joining a suffix that begins with a consonant to help the pronunciation. or there's another word root, combines two word root. Now, word building rules, rules that we need to remember. Summary of rules. The prefix is at the beginning of a term. The suffix is at the end of a term. Use a combining vowel when the suffix begins with a consonant to ease pronunciation, and terms have more than one word root. Now let's look specifically at plural endings. These apply these rules for your plural endings. Sometimes you add an S. One lung, two lungs. Words ending in A change to AE. One vertebra, more than one vertebrae. IS, words with IS change to ES. One diagnosis, many diagnoses. Words with EX or IX change to ICES. Apex, one apex, more than one APCs. ON or UM, words ending with ON or UM change to A. One ganglion, more than one ganglia. One ovum, more than one ova. Words ending with US change to I. One bronchus, more than one bronchi. Now, special word parts. Brief prefixes can indicate also numbers, colors, position, and directions. So numbers, some prefixes indicate that a term involves a number or two or more parts or sides. Uni is one, diply is double, null is zero, primisa, I believe, is around, multi more than one. Oh, primi is one, multi is more than one, bi is two. Colors. Several word roots describe colors. Examples: cyano, cyanosis, which is blue skin. Cyano is blue. Leuco, leukocytes, that's your white blood cells. Leuco is white. Erythro, erythrocytes. Erythro is red. Cero, what is cero again? Cero is orange or yellow, I believe. And melan or melano has to do with the color of the skin, black or dark. Now, position and directions. Prefixes can describe a position, direction, or location. AB, ab, means to move away from. Ad means to move towards. De or D means to move downward. Circum, circular. Peri, around. Trans means to pass through. Epi is above. Supra, above. Right, now let's look at common directional terms, movement, and position terms. Directional terms needed to discuss where an injury is located. So we have to be very specific when we give our report in terms of where the injury is located. And we have to be specific when we describe the pain that the patient is experiencing and how that pain is moving. Now, some directional terms that you need to be familiar with: right and left. And when we say right and left, it is the patient right and left. Superior and inferior. Superior is closer to the head, inferior is closer to the feet. Lateral and medial. Lateral means that the structure is away from the midline of the body. Medial means the structure is closer to the midline of the body. Now, when you think about the body, you will think about the body in what we refer to as a normal anatomic position, which we picture the patient with the head in a neutral position and the palms facing forward with the thumbs pointing outward. Now, if the palms are facing forward with the thumb pointing outwards, the thumb side would be lateral because it's away from the midline. And the little finger would be the medial aspect of the forearm because it's closer to the midline. Then you have your proximal and distal. And when we talk about proximal and distal, we're talking about a long bone, right? So we're talking about a long bone. The term proximal and distal is applied to long bones. A long bone has a proximal end and it has a shaft and it has a distal end. The proximal end of a long bone is the point of the long bone that is closer to the trunk of the body. When we talk about the trunk of the body, that is the chest, abdomen, and pelvis without your attachment. So the portion of the long bone that is closer to the trunk of the body is referred to as the proximal end. The portion of the long bone that is away from the trunk, further away from the trunk, is referred to as the distal end. So the bone in your forearm, the forearm bones, the radius and ulna, they have a distal end, a shaft, and a proximal end. The proximal end of the forearm bone would be close to the elbow. The distal end of the forearm bones would be close to the wrist, and the shaft would be in the middle. I hope that is understood. All right, let me clear this up. How do I clear it up again? Eraser. Oops. Give me a sec. All right, I don't remember. I'll have to play around with that. Now, superficial means it's closer to the surface of the skin. Deep means it's below the surface of the skin. And remember, when we talk about right and left, it's the patient right and left, not yours. Some other directional terms include ventral and dorsal. Ventral is the same as anterior, and dorsal is the same as posterior. Palmar is the palm surface of the hand, plantar is the foot bottom, apex is a point of a structure. So you have the apex of the lungs, you have the apex of the heart. And let's go over these terms again. So superior and inferior. Superior, nearer to the head, inferior, nearer to the feet. Terms describe the relationship of one structure to another. Example, the knee is superior to the foot and inferior to the pelvis. Lateral and medial. Lateral, that's outer, so body parts that lie farther from the midline. Medial is inner, body parts that lie closer to the midline. So the extremities have a lateral and medial aspect. Proximal and distal. Describe the relationship of any two structures on an extremity. Proximal is closer to the trunk. And remember, the trunk is the chest, abdomen, and pelvis without their attachments. Distal is farther from the trunk, nearer to the free end of the extremity. And when we think about these two terms, we apply them to long bones within the body. So when a patient has a fracture, we use these terms. Is it the distal end of the long bone? Is it the shaft? Is it the proximal end? And that's how you will be given your deformities, the description of your deformities in your practical. So I'm not going to tell you that a patient has a fracture to the distal end. I'm going to tell you that your patient has deformity just at the wrist. So the patient fell on his outstretched arm, and you can see deformity just at the wrist or slightly below the wrist. You should be able to tell me if that's distal, forearm, or proximal. If you can't, then we might have a problem. Right? Now, superficial and deep. Superficial means closer to or on the skin. Deep means farther inside the body tissue and away from the skin. Ventral and dorsal. Ventral refers to the belly side of the body or the anterior surface of the body. Dorsal refers to the spinal side of the body or the posterior surface of the body. Posterior surface of the body, example, dorsal fin or a dolphin. Ventral and dorsal. So more commonly, you're going to see anterior and posterior. But just know that ventral is the same as anterior and posterior is the same as dorsal. These are terms that you need to know, start using. If you don't use the terms, you're not going to learn them. Palmar and plantar. Palmar surface, front region of the hand, the palm. Plantar surface, bottom of the foot. Apex or apices is the tip of a structure. The apex of the heart is the bottom inferior portion of the ventricle that's located at the fifth intercostal space. That's where the apex of the heart is, and that's one of the places that we will put our stats to listen to a heartbeat as EMTs. As advanced, they have to use other points. As an EMT, that's a good point to listen to the patient's heart. Now, movement terms. So we're going to look now at movement terms. Flexion is the bending of a joint. Extension is the straightening of a joint. So if I bend my forearm and flex my bicep muscle, that is flexion of the elbow joint. If I extend my forearm where it's straight, that would be extension of the elbow joint. Adduction, with adduction, it's still movement of the extremity, but there is no bending of the joint. So adduction, ADD, add, is the extremities moving towards the midline. No bending. The extremities are just being moved towards the midline. Maybe you found the patient arm out and you're bringing it to the patient side, and when you're bringing it to the patient side, the patient start to complain of pain or discomfort. That would be pain and adduction, ADD. Maybe you're moving the arm away to check the mid-axillary portion, the armpit, and when you move it away, the patient is complaining of pain or discomfort. The AB, ab, would be moving the extremity away. That's abduction. Now, other directional terms, bilateral means both sides of the midline. Structures inside the body also appear on both sides of the midline. Unilateral, only one side of the body. So bilateral, lungs are bilateral, kidneys are bilateral. Unilateral, the stomach, spleen is on one side, the liver is on one side. Now, anatomic positions. These are positions that you can find your patient in. So we need to be specific with the positions that we find the patient in. Prone or supine. Prone means the patient is lying face down. So you find him lying on the belly surface face down. That's prone. Supine means the patient is lying on their back face up. Fowler's position is a sitting position, and it can be high Fowler's or semi-Fowler's. If it's semi-Fowler's, the patient sits at a 45-degree angle. If it's high Fowler's, the patient sits at a 90-degree angle. Now, breaking terms apart. So let's put what we have learned together. Use the meaning of parts to decipher the term. Define in this order: the suffix, the prefix, the word root. Nephropathy. Nephropathy. Pathy means disease. O is the combining form. Neph meaning kidney. Nephropathy is disease of the kidney. Dysuria. Dysuria. Ia means condition of. This means difficult, painful, or abnormal. Ur means urine. Dysuria, painful urination. Hyperemesis. Hyperemesis. Hyper, prefix meaning excessive. Emesis, word root meaning vomiting. Hyperemesis is excessive vomiting. Analgesic. Analgesic. Ik suffix meaning pertaining to, and prefix meaning without or absence of. Alges, word root meaning pain. Analgesic, pertaining to no pain. Now, abbreviations, acronyms, and symbols. These are shorthand used for communication. They are developed for speed. Do not trade speed for accuracy. Use only common understood acronyms and abbreviation to minimize errors, and some agencies limit the use of abbreviations. So be very careful with your abbreviations because it can be misinterpreted. So your report must be written so that somebody on the road can understand what it is that you're writing. And if you put certain abbreviations, if they are not universally accepted, the person who is reading the report must have a medical background to understand what you're saying. So it's open to interpretation. So be careful with the use of abbreviations, and if you're going to use abbreviation, make sure that they are universally accepted. Abbreviations take the place of words to shorten notes and documentation. Use only accepted ones to avoid confusion and errors. Be familiar with the abbreviation in your service area. Symbols, sometimes used as a shortcut. Use only accepted symbols. to avoid confusion / errors. These are things I try to avoid in my report, but as I said before, if your organization allows it, go ahead, just ensure that it is universally accepted and it is not open to interpretation. And that would be the end of this chapter. That's medical terminology.